Good evening, everyone, and welcome to another edition of the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women. My name is Patricia Bluett, and I am the section's corresponding secretary. And also joining us will be Alice Paler Diaz. She's going to be a member of the section's political committee. We thank all of you who have participated in our previous programs, and we hope you will be joining us again tonight with your questions by calling 412 853 8206. Our guest today is Dr. Amish Adala, and he is a senior scholar at Johns Hopkins Center for Health Security. This program tonight satisfies one of the National Council of Negro Women's national mandates to educate women about health and promote health care access. Today's program will also support the National Council of Negro Women's Good Health Wins initiative. Before we begin our show, we'd like to introduce our special guest by reading his bio. Dr. Adalja is a senior scholar at the Johns Hopkins Center for Health Security. His work is focused on emerging infectious disease, pandemic preparedness, and biosecurity. He also serves as an external advisor to the New York City Health and Hospital Emergency Management High Infectious Disease Training Program and on the United States Federal Emergency Management Agency Working Group on Nuclear Disaster Recovery. During the COVID-19 pandemic, Dr. Adalja served as a member of the National Collegiate Athletic Association Coronavirus Advisory Group. He has testified before the United States House Foreign Affairs Committee and the Pennsylvania House Health Committee. Dr. Adalja is also a Pittsburgh-based infectious disease, critical care, and emergency medicine physician and a native of Butler, Pennsylvania. Welcome, Dr. Adalja, and thank you for being on our program today. How are you today?
Thanks for having me. I'm good. Thank you for having me.
Oh, you are so welcome. So we're going to start right out. We'll have some questions. Oh, there's our other co-host. That's Alice. Alice, that's Dr. Adalja, who is going to be our guest today. So, Alice, do you want to start with the first question, or shall I go? Okay, Alice, we're having a problem. We can't hear you, so I'm going to ask the first question, and while you try to figure out what's going on, okay? It says, are we any closer to knowing exactly what is in the Corona-19 um, vaccination?
Closer to knowing what's in it. I think we've
Yes.
always known what's been in it. In terms of the COVID-19 vaccines, were part of a major program to develop a countermeasure against this virus. So COVID-19 vaccines basically contain the spike protein or the information to make the spike protein of the virus, which is what your body will form antibodies against. So the COVID-19 vaccines are designed to deliver to the body in a safe way a piece of that virus or the information to make a piece of that virus so that your immune system can react to it so that when you see the real thing, you are protected against severe disease, hospitalization, and death.
Okay. Um,
Can you hear me now?
Alice? Yes,
Yes.
we can hear you. Welcome, Alice. It's
Um,
great hearing from you.
so, are there are rumors that the vaccinations will now include some of the variants and subvariants in the flu vaccinations and the monkeypox vaccination all in one shot. Is that true?
No, these are all separate vaccines. We do have updated COVID vaccines that now are more directed against the variants that are circulating. The ancestral version of this virus, the one that first emerged in Wuhan in 2020, is long gone. It's basically extinct. So we've updated COVID-19 vaccines to more target the circulating variants. There are different flu vaccines and there's a monkeypox vaccine. They're all separate. There had been some talk of combining COVID and flu vaccines, but that really hasn't moved forward. So right now, they're all separate vaccines. You have a COVID vaccine, you have an influenza vaccine, and you have an Mpox vaccine. All three different types of shots. They're not combined in one.
Well, what is monkeypox vaccine? What is that?
So monkeypox was a disease that's been known for some time, at least since the 1970s, to be spreading in parts of West Africa. It's related to smallpox, and what it usually does is it infects children who get infected by being in contact with some type of animal, probably a rodent. And this has been going on in parts of Africa for some periods of time. And over the last decades or so, the cases have been accelerating. And what happened over the past year or so is that this virus, which can spread from person to person with close contact, got itself into a sexual network, primarily men who have sex with men. And that exploded the number of cases in all around the world. So we had about 35,000 cases in the United States. And because of that, so we knew a lot about monkeypox, and there had been a vaccine developed because monkeypox is so related to smallpox that the same vaccine works. And we had a vaccine on the shelf called Jynneos that could be used in high-risk individuals to prevent monkeypox from spreading. And that's what happened. So the monkeypox vaccine was rolled out about a year or so ago is when we saw that outbreak, and gave it to high-risk individuals. And we've come to control the monkeypox outbreak, or what we call Mpox now, in the United States. But the problem is that there's still cases that occur in Africa, and they need to vaccinate in Africa because that's where the source of that virus is, in those rodent populations there that infect children, then contact spread, and then kind of can spread and cause outbreaks. So until you actually deal with the monkeypox issue in West Africa, it will still remain a risk. But we do have a vaccine that is safe and effective. And if you're in a high-risk group, it's something that you should get.
Okay. Now, going back to the COVID-19 vaccination, there's still a lot of people that are hesitant to take it. What do you say to those who are afraid that they might have adverse reactions to the COVID-19 vaccination?
I would say that the COVID-19 vaccines are some of the safest vaccines that we've ever seen. And everything has really supported that point when we've seen how many billions of people all around the world have been vaccinated. And we know that COVID-19 is not a benign illness. Over 1.1 million Americans have died from COVID-19. And the vaccine is the key to protecting yourself against severe disease, hospitalization, and death. And the side effects that happen are very minor in general with these vaccines. So you do get some injection site pain, some muscle aches and pains, maybe a fever. That's usually all that most people have. There are some groups, for example, young adults and late teens, that can have inflammation of the heart from the vaccine, which is a known side effect called myocarditis. But that's very, very rare, and it's very, very mild. So when you look at what the vaccine does, the benefits it gives the individual getting vaccinated, it way outweighs the risks that there are from that. And especially if you're somebody that has any high-risk condition, you're above 65, you have diabetes, heart disease, lung disease, kidney disease, immunocompromised, you're overweight, you're obese, you're pregnant, that's where the vaccine really has value. And I would urge people to get the vaccine if they're in one of those groups, especially as we move into the fall.
So does the vaccination cure the disease or just prevent the disease from spreading or prevent you from getting the disease?
So the vaccine's chief purpose is really to prevent you from having severe disease, being hospitalized, or dying from COVID-19. The vaccine doesn't really have the ability to block infection anymore. In the early days, back when it first came out in late December of 2020, in January 2021, when the virus was kind of still in its ancestral form, there was a lot of blockade happening in terms of transmission. It was stopping people from transmitting. But the virus, just like we expected it to, mutated away. It started to shoot off these variants. And so the vaccine is not really able to block infection, but it does what it's designed to do. And that's keep people out of the hospital, keep people from dying. So that's the chief value of this vaccine at this point, is to really make COVID-19 a minor illness for people, not something that lands them in the hospital.
So if you get the vaccination and it stops it from spreading, what are your chances of catching it, getting it again?
Well, so remember that the vaccine doesn't stop it from spreading anymore. The Omicron variants of this virus are not something that the vaccine can block transmission of, except for maybe temporary. But what the vaccines do are prevent severe disease. So if you get vaccinated and you get infected, you can get infected again, just like other respiratory viruses. This virus is going to be with us forever, and it's going to continue to mutate to be able to infect us despite vaccines, despite people's prior infections. But what it won't be able to do is cause severe disease. It won't be able to crush hospitals the way it once could.
Mm-hmm. Oh, okay. Mm. So are we any closer to knowing
Now,
what
if
exactly?
I've already had 4
Oh,
or 5 vaccinations.
You've had
Right.
the 4 or 5.
Okay,
Yeah, so
Alice, did you? Okay. Right. If I've already had
So-
4 or 5 shots, do I still need to get another booster?
If you're somebody that's in a high-risk group, meaning you're older, diabetes, hypertension, cardiovascular disease, heart, liver, kidney disease, immunocompromised, pregnant, yes, you should be getting the new booster when it becomes available in the next couple of weeks. Because what happens is if you have high-risk conditions, the prior vaccines, the prior infections, they lose their ability over time to prevent you from getting severely ill. So that's why when we talk about high-risk people, want to make sure that they're up to date, that they're getting the boosters when they're available, because they're the ones that we see getting hospitalized. They're the ones that we see dying from COVID-19. So even though a high-risk person might have had 4 or 5 shots before, they still need to keep up to date, because those are that protection wears off against against severe disease. So they're still at risk for severe disease. So that's why this booster that should be out in the next couple of weeks is going to be a priority for people that fall into any of those high-risk categories.
Okay.
Will,
ahead,
will there be a COVID-19 vaccine that covers all of the coronavirus variants?
Hopefully someday we will have a vaccine like that. It would be sort of the holy grail. What we have now are vaccines that kind of give us some protection. But if we had what would be called a universal coronavirus vaccine, we wouldn't have to worry about updating it and these booster campaigns happening with frequency. And I think that's something that people are working to do. There are companies, there are researchers that are trying to sort of unlock the secrets of the virus to be able to find a target that doesn't change, that doesn't mutate, so that we could have a vaccine that covers all the variants. But right now we don't have that, and it probably is several years away.
Oh,
Okay.
okay.
Now I want to ask a question about RSV. I remember years ago, it was something that only babies or young children got, but now I'm hearing more and more people. So where did it come from, and how do you contact it, and who is most at risk of getting RSV?
So RSV is a virus that's been around since the 1950s. And yes, it's true. Everybody thinks of it as a childhood disease. It's the most common cause of infant hospitalization, but it's always caused disease in adults. So if you look at people above the age of 65, RSV has a similar burden to influenza, meaning tens of thousands of people above the age of 65 die every year. It's just that they were never counted. Nobody ever really paid much attention to it because it was a pediatric disease. It was thought of as a pediatric disease, but that's really false. It's always been also a disease of adults. RSV is a respiratory virus, so it spreads through coughs and sneezes and droplets that come out of your mouth when you're talking. That's how it spreads, similar to influenza. And the people that are most at risk are the very young, the people that are below the age of 1 year of age, and then people that are above the age of 65, especially those with other conditions like emphysema, or COPD, or had any kind of lung disease or heart disease. Those are the people that we see having severe disease. So the very young and the very old are the ones that are at risk for RSV. And the good thing about RSV right now is that we have vaccines available for the first time ever. So this is something that if you're above the age of 60, you should consider getting an RSV vaccine now, today.
So should everyone get a vaccination or just people who are ill?
Well, the RSV vaccine is approved for people above the age of 60. So you have to be 60 years old. But the more other conditions you have, and you're above 60, so maybe you have hypertension, maybe you have CHF, maybe you have COPD, that raises the stakes. And those are people who should really be running to get this RSV vaccine. But I think anybody above the age of 60 would benefit from getting this vaccination. But the more other illnesses you have, the more you're going to benefit from it.
Okay.
That's okay. So
Yeah.
is there a new outbreak of RSVP, and are there known cases of RSV in Pittsburgh, and what are the symptoms?
So there definitely are cases of RSV in Pittsburgh. There is an outbreak or a lot of cases that are in states like Georgia and Florida. The CDC put out an alert just a couple of days ago about rising cases in Florida and Georgia. But there are cases everywhere. RSV always circulates everywhere in the United States. And the symptoms can range from just fever, stuffy nose, common cold-like symptoms, to shortness of breath and really bad cough, to fevers and chills. So it has a spectrum of illness, just like COVID. Some people have mild symptoms. Some people have very severe symptoms.
Hmm. Now, for children, for RSV, should they be receiving also the vaccination, and how often and how far apart should they get these?
We don't have a vaccine for children yet for RSV. They have an antibody treatment that we can give children as a preventative for children below the age of 2 years. There's work to make an RSV vaccine for children, but it's not yet available. So we protect them with antibodies. And interestingly, one of the vaccines can also be given to pregnant women in their third trimester, and the antibodies pass through the placenta and protect the into the fetus and protect that baby when it becomes a neonate for the first 6 months of life. So that's how we're protecting children.
I have
see
a
in the
question
chat.
about right.
Yeah.
Oh, in the chat, I have a question. One more question. If a child had RSV as a baby or an infant, are they one of the ones that should be concerned as an adult and be checking into this new vaccination?
Yes, everybody gets RSV as a baby. You might not have been hospitalized for it, but nobody really reaches 2 years of age without getting RSV. But over time, your protection against severe disease from those early bouts of RSV as a child, that wears off. So by the time you're 60 years old, you have a risk for severe disease. And that's why we're targeting adults above 60 with this vaccine.
Okay. Now we have a question from in our chat, and it
Yeah.
says, "How often do you have to wait between getting the RSV vaccination and the COVID booster?"
You don't have to wait at all. They can be given at the exact same time. But remember, the new COVID booster is not out right now, but the RSV vaccine is. So you've got some time. The RSV vaccine, you can get the vaccine booster in a couple of weeks, but you could get them both on the same day. I would recommend getting them in different arms and prepare for your arms to hurt because getting two vaccines.
Okay.
So how can we protect ourselves against catching RSV?
You can protect yourself from, so RSV is very hard to protect yourself from getting because it's a respiratory virus. So anytime you socially interact, there's always a risk. But yes, if you're high risk, you can think about the same things you did to protect yourself against COVID: hand washing, wearing a mask in crowded congregated areas, moving activities outdoors. All of that helps with RSV. Staying away from sick people, especially your grandchildren, if they might have colds, that could be RSV. But the best way to protect yourself against RSV now is get the vaccine if you're above 60.
Okay.
Okay.
Okay. I have another question about monkeypox. What are the symptoms of monkeypox? And if someone has it, how does it spread from one person to the other?
So monkeypox, the symptoms of monkeypox or mpox are a fever, chills, muscle aches and pains, and a very characteristic rash. So if you look up the old pictures of people with smallpox, that's what that rash looks like. This raised, bumpy lesions all over your body. That's what monkeypox, that's what the symptoms are. And in certain people, it can be very severe. There can be lots of pain from that rash. The rash can kind of get internal and cause a lot of problems. And it spreads through close contact, person-to-person contact, skin-to-skin contact. It's not something that spreads very easily. And that's why we were able to control a lot of it, even before the vaccine was in a lot of people's arms, that we were able to, people could change their behavior and you can stop it. It's not something that spreads very easily. You really have to have close contact with another individual, skin to skin.
Okay.
So being vaccinated, would that stop a person from infecting other people?
For which disease? For monkeypox?
For the monkeypox or the COVID-19?
Yeah, so for monkeypox in general, yes, that vaccine is pretty durable. People are not really going to be able to get infected, or if they do get infected, it'll be very mild. So it does decrease contagiousness. With COVID-19, in general, being vaccinated doesn't necessarily prevent you from being infected and doesn't necessarily prevent you then from transmitting it. It did. At one time it did, but the virus mutated so much that the vaccine doesn't really have that property anymore.
Well, should children and adolescents get vaccinated against the COVID-19?
I do think that I think that children should have at least gotten the primary series, because it's as I said, a safe and effective vaccine, and it minimizes the risk of COVID-19 causing any problem or disruption. So I do think that it was a good thing to recommend that children and adolescents get vaccinated. Whether or not they need to be boosted, I think matters more about, it really depends upon if they've got risk factors for severe disease. So there are some children that have transplants or have medical conditions like asthma. Those individuals should continue to get boosted. A healthy child, I think, will probably find less value in continuing to keep getting boosted, but it wouldn't hurt them. It's pretty marginal in terms of, but the benefit is pretty marginal. So again, high risk children, I think, should stay up to date, just like high risk adults should stay up to date. I think children should have been vaccinated early on. Whether they need to keep boosting, I think, depends upon their underlying conditions that might be present.
There's a certain amount of vaccinations and shots that children get, part of the immunization series that they get when they're growing up. Will COVID be considered one of those things that will be added to that?
It's not right now. So COVID is not part of the routine childhood immunizations yet. I do think it makes sense to make it part of the childhood immunization, but there's a lot of controversy over that. So it may take some time before it becomes a routine vaccination, but there's no reason why it shouldn't. We vaccinate against chickenpox, for example, that's on there, and other diseases like rotavirus that are less important, I think, than COVID-19. So there's no reason really to exclude it from that list, but I think it will be some time before it becomes a routine childhood immunization.
Now, I just let me ask this one more question about these childhood immunizations. Most children will receive a shot against measles and rubella and mumps. Now I'm hearing that they're telling adults that you have to go back and get another measles vaccination. Is that true?
No, it's not true. So measles vaccination is a really, really strong vaccine. We give people 2 doses of measles vaccines, and they really protect you from infection almost 99% of the time. That's a vaccine that's probably one of our best vaccines. So adults don't need to go back and get a measles vaccine. And if you were born in the 1950s or so, you're all immune from having natural exposures, because measles was a very common illness before the vaccine was available. So nobody has to go back and get measles vaccines.
Okay, thank you.
Mm-hmm. Well, some of us have already received the 2 vaccinations and the booster shot, and some of us have even gotten up to 4 shots. So is it true that we may have to get the booster shot every 6 months or so to ward off the virus?
It all depends upon if you have risk factors for severe disease. So every 6 months, probably for very frail people that are immunocompromised, maybe they've had a transplant, maybe they have immunosuppressive medications being prescribed to them, those individuals will need to be boosted more frequently than somebody that's not. So it all really depends on your risk factors for severe disease. So a healthy 20-year-old probably doesn't get much benefit by getting all these boosters. However, you take that patient and make that a 60-year-old diabetic, yes, they probably should be getting all those boosters. So it really depends on your risk factors for severe disease.
Okay.
We have a caller on the line.
Can you turn down
We
your
have
audio
Donna
in the
from
back?
Homewood. So we're going to bring in Donna from Homewood. Hello, Donna.
Here it is. Okay. Oh, hello. Can you hear me?
Yes, we can. How are you this evening?
Fine. How are you?
Great. Do you have a question for our doctor?
Yes, I have 3. Can I ask them one at a time?
Mm-hmm.
Yes.
Okay. The first one is, can a person build up their immunity without taking the shots and boosters? I know a lot of people say that they take enough like vitamins and zinc and magnesium magnesium and all that stuff where they don't really have to worry about taking the shots or the boosters.
Well, so that's the idea of natural immunity. And I think, yes, when you get infected with the virus, you will build some immunity, but it's a risky way to build up your immunity because you don't know how severe your illness is going to be, especially if you have any risk factors for severe disease. And remember, the majority of Americans have at least one risk factor for severe disease. So I wouldn't say that's a good way to get immunity because, first of all, you might end up with severe disease. Number two, you could be one of those 5 to 10% that gets long COVID. And we know that vaccines decrease the risk of long COVID. So yes, you get immunity from infection. Natural immunity is something, but I don't know if that's the best. I don't think that's the best way to actually develop immunity to COVID because there's these unknowns that you may have. So nobody should want to get COVID. You should, and if you do get COVID, it's better. It's much better to get it after you've been vaccinated, even if you're low risk, because it decreases your chances of long COVID, for example.
Oh, okay.
Okay, I was talking about the not that you get the COVID in order to build up immunity, but even before you get COVID, is there a way to immunize yourself by the foods you eat and the vitamins and supplements you take, not the vaccine itself or the disease, but just by keeping your body healthy, immune free?
So the more nutritious your diet is, the more healthy you are, the less likely you are to get respiratory viruses. So for example, if you're somebody that's vitamin D deficient, you're going to be more likely to get COVID. So having a balanced diet, making sure that you're getting all the appropriate minerals and nutrients does make your immune system work better, but it's not a guarantee that you won't get COVID. You can have a normal vitamin D level and be completely healthy and still get the virus. It may be less severe because you're healthier, but it's still not a substitute for being vaccinated. But I do think that it is people about their nutrition because it helps their immune system respond. But it's not the only thing. I think that the vaccine is still necessary, even if somebody has a very nutritious diet and has no vitamin deficiencies.
Okay, thank you. Then my second question is there such a thing as herd immunity? I know when the disease first came out, they always talked about, we're waiting for herd immunity to occur. And is it here, or is there such a thing as herd immunity?
So the concept of herd immunity does apply to many infectious diseases. Measles is a good one. And what herd immunity means for people who might not know is that the more people that have immunity to an infection in a given community, the harder it is for that infection to spread. And with COVID-19, herd immunity has really not been something that we could achieve because the virus continues to mutate to be able to get around some of that immunity to be able to infect us. But what we do have is herd immunity against severe disease. You can look at the hospitals, for example, in Pittsburgh, and I was working in one of our local hospitals today. We don't really see hospitals under pressure from COVID-19 because the immunity that we have in the population from vaccines, from boosters, from prior infections, combinations of all of those, that keeping people out of the hospital. So in that sense, the community is becoming more resilient to severe COVID, but we still have COVID-19 infections in the community because the virus continues to mutate. So it's not something where we get traditional herd immunity the way we do with measles, for example.
I see. Okay, thank you. And my last question, which you almost answered, I think, was, I don't really see people wearing masks anymore. And I'm wondering, is it because there's less of a threat of COVID, or are they really effective masks? That's my last question, and thank you. I'll hang up and listen to that answer. And everybody have a good day.
And you do the same. Thanks for calling in.
Thank you.
Thank you.
Bye-bye.
So COVID has definitely become less of a threat because there's so much immunity in the population. We have antiviral drugs like Paxlovid. So yes, I think people can breathe a little bit of a sigh of relief, and that translates to them not thinking a mask is as necessary. Masks didn't work. It depends on the mask you're wearing. You can't just take a sock and wrap it around your face. You really need a highly effective mask, like an N95 or an N95 equivalent, and you need to wear it appropriately. What happens in these mask studies is that when you put them in the real world, people don't wear them that well. They stick their finger underneath it to scratch their nose. They take it off when they're talking on the phone. They do a lot of they have a lot of bad habits. So it's not really the mask. It's actually implementing the mask on the human. That's the problem, because in the hospital, we wear masks a lot when we're taking care of patients with infectious diseases. So when you put them in the real world, though, they don't work so well because people are people. But yes, they do work. And I think for high risk individuals, they are a tool you could use when you're in a crowded, congregated indoor setting. And I would emphasize that the mask you use should be something that is high quality. As I said, an N95 or N95 equivalent, not some flimsy gaiter or some pantyhose that you put around your mouth. And I've seen people do that too.
Okay. I do have a question. You brought up something a moment ago when you were talking, and you mentioned long COVID. What actually is long COVID? What are the symptoms? And if someone has it, what should they be doing, or what do you do?
So long COVID is a word that we use to describe people who have COVID. They get over the initial part of COVID, but they're left with these lingering symptoms. So symptoms like fatigue, headaches, brain fog, inability to exercise, getting really tired all the time. And we don't really have an explanation for it, but there's probably about 5 to 10% of people who have COVID that end up with this long COVID. And it may be more than one thing. We don't have any way to diagnose it. We don't have any diagnostic criteria. It's kind of a catch-all term, an umbrella term right now. And one of the biggest tasks we have right now is to define long COVID, to understand what is it biologically, and to really know what to do. So right now, if you're somebody who's had COVID and 3 months later still having symptoms, you should talk to your doctor, because there are long COVID clinics that are trying to study individuals so that we can develop treatments. But we're a long way from that. We're just scratching the surface of this idea of long COVID. And even though it occurs in maybe 5 to 10% of people, you have to remember 5 to 10% of a big number is a big number. And we have a lot of people that likely have long COVID. And I think this is one of the most pressing challenges we have. And it's one of the long tails of the pandemic that we have to unravel.
Well, those people who have it, do they need another booster shot, or how many booster doses of COVID-19 do a person need?
Well, if you have long COVID, you probably should still get boosters because you don't want to get infected with COVID again. But again, the value of the boosters really has to do with underlying disease. So if you're a high-risk person, you should be keeping up to date with your boosters. There are some studies and some anecdotes that people with long COVID, when they get a booster, they feel better. We still don't understand why that is, but some of them do. So I would say that someone with long COVID should keep up to date with the boosters. And we don't know how many numbers of boosters you have. A high person, it's like seatbelt. You don't ask how many times do I need to wear my seatbelt. If you're a high risk person, you want to continue to use the boosters.
Oh, okay.
Now, some people have had all the shots and they're still testing positive or having reactions that are considered COVID. Some of us have never been infected with COVID, and others multiple times. Some of those infections are asymptomatic, while others develop such serious symptoms that it ends in death. What are we learning about the extraordinary differences in the reaction to COVID, and is the death toll going down?
So we know a lot about COVID-19 in terms of who is at risk for severe disease. So yes, people can have a very, very mild illness where it's asymptomatic, and some people can be deathly ill. And some of that's explained by people being older, people having underlying conditions. You're more likely to have a severe case if you have underlying conditions. You're more likely to have a severe case if you're not vaccinated. And then there's also some differences between all of our immune systems, all the genetics that make us up are going to differ from person to person. And there is some variation that plays a role in how severe your COVID-19 episode is. So there's a bunch of different factors that play a role, but the biggest one is age and underlying conditions. That's what we know. I forget the second part of the question was what? There was a second part that I thought.
About the death toll, is it?
Yeah, so the death toll is going down.
Okay.
We used to have days where 3,000 people in this country would die. Now it's in like the 50s, 60s per day. That's a major improvement because of the vaccines, because of drugs like Paxlovid, because of the immunity in the population, and because of the knowledge of doctors like me that have been taking care of patients day in and day out. We were for some time. So we learned a lot about COVID. So yes, the death toll is going down considerably. It's becoming much, much more manageable.
Okay. Well, what is the difference between COVID-19 and SARS-CoV-2?
So SARS-CoV-2 is the virus that causes COVID-19. So COVID-19 is the name of the disease. So just like we say HIV is the virus that causes AIDS, SARS-CoV-2 is the virus that causes COVID-19.
Oh, so how do you determine if you have SARS-CoV-2?
Well, that's what you're testing for. When you take a home test, when you get a PCR test, they're actually looking for the material of SARS-CoV-2. We just call them, by shorthand, call it a COVID-19 test, but they're really SARS-CoV-2 tests.
Oh,
What is the current recommendation following exposure to someone who has COVID-19?
So if you're exposed to someone with COVID-19, you should be very alert for the development of symptoms, probably in about 2 days, and start to test yourself and be very wary about being around other people. And you may want to wear a mask in that situation. But that's what we're still recommending for people with exposure. So test yourself starting around day 2, or if you develop symptoms, and think about wearing a mask for several days after that exposure, so you don't spread it to somebody else.
Okay.
well, can females who are pregnant or breastfeeding be vaccinated? Would that affect them if they're pregnant or breastfeeding? Would it affect the baby if they're
It would affect the baby in a good way. So pregnant women are high risk for severe COVID. So pregnant women, we actually encourage pregnant women to get vaccinated when they're pregnant, because it not only does it protect them, but the antibodies that are formed will cross the placenta, go into the fetus, and protect the newborn, just like we mentioned with the RSV vaccine for pregnant women. So pregnant women are a priority to be vaccinated, and it protects not only them, but the developing fetus. It protects their pregnancy and protects their baby for the first 6 months of life. And the same is true for breastfeeding. When they're breastfeeding, the antibodies will pass through the breast milk and protect the baby. So that is something also that we recommend.
Okay.
Now, what are the current recommendations following exposure to some? No, I'm sorry. What is the current quarantine or isolation requirements for anyone testing positive?
So if you test positive for COVID-19, you should try and isolate for 5 days, starting on the day after your symptoms. That's when day 1 begins. And then after those 5 days, you can be around people wearing a mask. Obviously, not everybody can follow that. So if you are somebody that's in those first 5 days and you can't isolate, you can be around people wearing a mask, do things outside. But in general, yes, try to isolate for 5 days and then wear a mask 5 days after that.
Okay. Well,
how soon after you start feeling like you might have COVID should you be testing yourself to see if you actually have it?
I think a person should test themselves with the onset of symptoms. And if it's positive, you've got an answer. If it's negative, continue to test. But also remember that there's not just COVID going around. We talked about RSV. We're starting the flu season. So there are many respiratory viruses that feel exactly the same. So if you're feeling sick and you test negative at home for COVID, think about maybe talking to your doctor about getting a flu test as well, or an RSV test to see, or getting evaluated. But I would test as soon as you get symptoms, and then test, another 24 hours later, to see if it's COVID. But remember, there's still other viruses out there that are important. And if you've got flu, for example, you may want to get a drug like Tamiflu to help prevent complications from flu. So make sure you just don't only think about COVID-19 and forget all the other respiratory viruses.
Is COVID-19 continues to be a reportable disease to be reported to the local health department or to CDC?
COVID-19 is still reportable, but it's mostly reported from health departments, from hospitals, from laboratories. So the home tests are not reported, but yes, COVID-19 is still reportable, and they still track that. But we always know that the number that are reported are a big underestimate, probably 10 or 100-fold lower than what the actual case count is. That's why we look at other things to understand what's going on.
Oh, okay.
Do you think that universal masking should still be required?
No, I don't think that universal masking should be required. I think masking is one tool among many that people can use. And I think organizations can set their own rules. If you're a school, if you're a organization or a club, you can decide your own rules about masks. I don't think that this is something that the government should be doing. I think that actually got people up in arms and made this much more controversial than it was. But I would say that people need to take individual responsibility and think about the fact that wearing a mask protects yourself. So if you're a high-risk person, you don't need the government to tell you to wear a mask. You should know that if you're a high-risk person and you're going to a train station and there's hundreds and hundreds of people around, maybe you should be wearing a mask. So that's something that people have to learn how to do. They have to learn how to risk calculate. So masking is one tool that can be used I think, for high-risk people, but it's not something that I think we will see the government get involved in again.
Okay.
Okay. Is the one-way masking, is it effective, or how effective is it?
One-way masking is effective, but only if you're wearing a highly, an efficient mask. Not, as I said, someone putting a sock around their mouth. That's not going to help them. But if they're using an N95 or an N95 equivalent, one-way masking is highly effective.
Oh, okay.
Okay. Is there a coronavirus surge coming in the fall and winter this year?
It's likely to be the case that COVID-19 transmission will accelerate in the fall and winter, just like it's accelerating now. We know that people like to go indoors. Schools are open. People are interacting. All respiratory viruses tend to favor the fall and winter season. So we do anticipate COVID-19 cases to increase when it becomes fall and winter. But we're right now in the midst of an increase as well, probably because the hot weather drove people indoors, which led a lot of people to spread the virus in indoor settings.
So should children receive the vaccines or receive the monkeypox vaccine? Or what
Children
age
don't-
should they
No, the
receive?
children, most children are not going to benefit from the monkeypox vaccine in the United States. As I said earlier, in Africa, yes, I think children probably should be getting vaccinated with monkeypox because that's who's getting infected from animal contact in Africa. But I don't think children need to be getting the monkeypox vaccine routinely in the United States unless they're a close contact. Maybe if a parent or one of their friends or uncles or whoever it might be has monkeypox or it exposes them, the vaccine might be of use in that situation. But I don't think routine vaccination of children against monkeypox is necessary in the U.S. at this point.
Okay. Now, over the last 2 years, regarding the viruses, what are the things that we should be doing and the things that we are not doing?
Well, I think that people have to recognize that this virus is not going to go away. It's going to be with us this year, 5 years from now, 50 years from now. This virus is always going to be one of the respiratory viruses we contend with. So people have to learn how to risk calculate, how to live in a world in which there's always going to be COVID-19. And I think what you do about it depends on your risk tolerance and your risk factors for severe disease. It's not one size fits all. So if you're somebody with high risk conditions, you should, for example, make sure you're up to date with the boosters. If you get sick, you call your doctor very quickly to have a prescription for Paxlovid sent to your pharmacy. You should be really quick to use home tests. You should be very wary when you're in crowded, congregated areas and not wearing a mask. Those are things that are dependent on your risks for severe disease. For the average risk person, I think it just depends on how much they want to avoid the virus. But really, for lower risk people, it's becoming more and more manageable. So it's not something that a low risk person has to think of in the same way that a high risk person thinks of. As I said, it's not one size fits all.
We have another caller on the line. We have Tony from the Hill District. Hello, Tony. Are you with us?
Hi, I think this is a very informative show. I'd like to say that first. Thank you all so much for having your guest on. I know he was saying about the mask to wear. I see the N95 and KN95. And what about the mask that they wear at the hospital that everyone can get? They have like 50 in the box. Would you say that is a safe mask that people can wear?
So I do think that the surgical masks or procedure masks that you see at the hospital in the box, those are effective. They're not as effective as a KN95 or an N95, but they are effective and much better than the homemade masks that people were wearing. So I do think that those serve a purpose. They're just not 100% the way a KN95 or an N95 or a KF94 may be, but they are an effective type of mask to use.
Okay, I heard you mention KN94.
No, KF94.
Okay, I've never seen that one, so I will be on the lookout for that one. And I just wanted to speak about, you don't think the government should be involved. I thought that was an interesting statement because I always thought they should have spoken one voice. If the government had spoken in one voice and the hospitals had spoken in one voice, there wouldn't have been so much of a mass confusion. People fighting about wearing masks, people, fighting authorities about wearing masks because they didn't speak in one voice. So that was an interesting statement that you made. And I was curious about that because I just felt it could have been easier had the hospitals and the government spoken one voice. So, but thank you for the information about the masks, and I'll continue to listen to the show. And thank you, NCNW, for this informative program.
You're
Thank
welcome.
you.
Thank you
I
for
just
calling.
want to comment on what she said. So I agree with the caller about the fact that if the government and hospitals spoke with one voice, things would have been much better. But I think the larger point I was trying to make about the government being involved is when public health authorities in the government are trying to handle an outbreak, it's much better when they make recommendations and ask for the population to do something voluntary. Because as soon as you make something a mandate, it's going to really raise people's eyebrows, and it's going to cause people to rebel just for the sake of rebelling. And I think that it really defeated its purpose, because masks became such a political issue because they were mandated. And you had politicians in one tribe saying, we hate these mask mandates, and then a politician in another tribe saying, we like these mask mandates. And that just made everything get seen through the lens of politics. And we all know when that happens, nothing gets done, and everybody's at each other's throats. And that's exactly what's happened. And it's happening even today over masks, even though there are no mask mandates currently.
Well, what can we expect to see during the upcoming flu season that's about to come? Can we get or should we get the fly shot and the COVID-19 vaccine?
So the flu season, we don't know what it's going to bring, but we know, for example, in the Southern Hemisphere, which is just coming out of winter, that they did have a fairly normal flu season. So we can expect a brisk flu season to start soon. I haven't seen any flu cases around yet, but they're coming. And I do think everybody should get the flu vaccine. I usually recommend that people get it in October so that it lasts the whole season. And remember, if you're older, above the age of 65, there are special flu vaccines for you. There's high-dose flu vaccines, adjuvanted flu vaccines that do a lot better job at protecting you. But flu vaccines in October. And as I said, you should get the COVID vaccine if you're in a high-risk group next week, maybe as early as next week when it comes out. As soon as a new booster comes out, if you're in a high-risk group, you should get the COVID vaccine. And then in October, I would get the flu vaccine.
Oh, okay.
Okay. Should we still report COVID-19 side effects?
Yes, you should report side effects that you're getting from COVID-19 vaccines. You should report COVID-19 if you the symptoms that you're having. Yes, that's all reportable. People are still studying this, and it's important to report all of that.
Now, individuals that are smokers, are they more prone to get the COVID-19?
In general, people, So when people smoke cigarettes, it damages their lungs, but it also damages their upper airway, where they're inhaling the smoke and all those toxic chemicals in the smoke. So they are more prone to get respiratory viruses like COVID-19. So one of the defenses is that you have these little hair-like projections in your microscopic hairs that are in your cells in your airway, and they kind of beat like a drum, and they beat kind of like I guess like a wave, and they send all those viruses out. They trap them, they push them up. And if you smoke cigarettes, those little microscopic hairs get paralyzed. They get damaged. They don't do so well. So that's why smokers are more likely to get respiratory viral infections. So stopping smoking is another way to help protect yourself against COVID-19 and other respiratory diseases. And you should do that for a whole host of other reasons as well.
Okay. Do the COVID-19 testing only test for the Delta and the Omicron variances?
No, COVID-19 testing is for all variants. It doesn't really matter. It will pick it up no matter what variant it is. So COVID-19 testing tests for everything.
Okay. And now getting back to the SARS virus, can that be transmitted by blood transfusions?
Not efficiently, no. It doesn't really get So SARS-CoV-2, the cause of COVID-19, is a respiratory virus. So it's not really transmitted through the blood. It's transmitted through respiratory droplets, the air that you breathe. That's how COVID-19 moves from person to person. That's how SARS-CoV-2 moves from person to person. It's not really a bloodborne disease.
Oh, okay. So then it's okay. It's safe to donate blood during the COVID.
Yes, it's safe to donate blood.
Okay.
What is this new updated COVID-19 booster shot, and when should it be ready, and why should we start taking it?
So the COVID-19 booster shot is updated to more match the versions of the virus that are circulating now. As we talked about earlier, there's lots of variants. So there's a variant circulating now, and this vaccine is better matched to it. So that's why they've updated it. It should be available as early as next week if everything goes well, but it's anticipated to be available by the end of this month for sure. And as I said earlier, if you're somebody that's in a high-risk group, this vaccine booster will benefit you. it will prevent you from getting severe disease. So when it becomes available, if you're in a high risk group, you should go get the vaccine booster.
Now, because things are changing, can people still go to, are they shots going to be offered free to people, or do they need to make arrangements with their own medical doctors to get the shots?
So shots are no longer out-of-pocket cost free. There are some programs that are available. So if you're on Medicare, Medicaid, those shots will be no out-of-pocket costs. Private insurance, it's likely to be no out-of-pocket costs. If you're uninsured, there are programs that the Biden administration is putting in place. They're not quite ready yet, but there are ways to get that. I would recommend, if you fall into one of those categories, look at that. Talk to the health department. There are federally qualified health clinics that may also have that vaccine that you can get. So there's a bunch of different ways to do it. But in general, this shouldn't be a very high cost for people. Most insurances, including Medicare and Medicaid, will cover it.
Okay.
Well, how many booster doses of the vaccine should we get?
It all depends upon your risk factors for severe disease. So somebody that's had a lung transplant should get as many as are recommended. As I said earlier, I used the analogy of a seatbelt. People don't say, how many car rides do I need to wear a seatbelt in? So if you're a high risk person, you should be getting up to date. You should be staying up to date with boosters as they become available. If you're low risk, it's probably not that big of a deal if you miss some boosters.
Oh, okay.
Okay. Is it safe to donate blood right now during the COVID-19?
Yes, it is. It is safe to donate blood.
Okay.
Now, also, there's a rumor with the COVID-19 vaccine. Does it cause infertility in women?
That's a bad rumor. There's no evidence that the COVID-19 vaccine causes infertility. In fact, in the clinical trials, people got pregnant during the clinical trials. So no, there's no change in fertility with the COVID-19 vaccine at all. That's a wicked rumor that got spread.
Okay.
Now there was, I think it was Johnson & Johnson was offering the single booster shot. Is that something that children should be receiving, or are they still offering that shot?
So Johnson & Johnson had a single dose vaccine that was available. It's no longer available, and it was only available to adults. So it wasn't something that children had. So the Johnson & Johnson vaccine is no longer available.
Okay.
Are there any side effects from the COVID-19 or the vaccines?
Well, I think we've covered a lot of the vaccine side effects. So fever, chills, muscle aches and pains, that's usually what most people get with the COVID-19 vaccine. Rarely in boys that are in their late teens, early 20s, they can get inflammation of the heart, which is very, very rare and not very and very mild. But those are the main side effects that we see with COVID-19 vaccines.
Okay. We have another caller on the line. We have Mark from the north side. Good evening, Mark. How are you?
Yes. Hello. Am I on the air?
Yes, you are. Welcome.
Yeah. Hi. Listen, it's always good to hear you ladies here with your programming and sharing information. You know, I was kind of torn on this show on how I should go, but I gotta tell you, and good evening to the doctor as well, concerning this COVID situation, I'm just wondering, has anybody ever formally digested and recorded to the community the report that came out, I want to say maybe a year ago, from the new director of health, and she kind of picked apart the previous administration's handling, promotion and marketing, and kind of hysteria on that whole COVID thing that put this country, under some serious lockdown stuff. Have you had an opportunity to discuss that? It does that weigh heavy at all on the conversation? I'm just curious.
So I do think that there's a lot of controversy over what happened during the early days of COVID-19, including the lockdowns. And I think the only way to understand what happened there is to realize that what happened at the federal level was that in January, February, and half of March of 2020, the government did very little. They basically evaded the fact that this was going to be a pandemic. They did not take the right actions, and the actions they took were the wrong actions. They really fouled up testing to the point that we had no idea who was infected. We had no idea where things were spreading. We were basically flying blind. And what happened was people saw what was happening in New York City with hospitals getting inundated and governors all across the country panicked. Blue state, red state governors, they all panicked, and they used very, very blunt tools. And I think we're now seeing the consequences of a failure to plan for pandemics, that we had to use, or they thought they had to use, these lockdowns and blunt tools that had a lot of cascading negative effects on our schools, on our mental health, on our cancer screenings, on our economy. And that's not the way it should be done. We should have been more precision guided. We should have used targeted interventions the way they did in places like Taiwan, places like South Korea. But we lost that opportunity because we screwed up so bad in the early days of the pandemic. And that is really a failure of government, failure of federal governments, state governments, local governments, school boards, all the way. They really failed us. And I think one of the lessons from this that everybody listening should take is that you have to hold these people accountable, these elected officials. They have to start prioritizing public health. They have to start prioritizing pandemic preparedness, because we can never let them do this again. They have to be able to be proactive. And that's the issue with why these lockdowns happen and why we need to get a better system so we don't ever have to resort to those again.
Well, that was fantastic.
We have
go ahead,
5
Mark.
minutes left. We're going to have to wrap this up.
Okay.
Thank you.
All
Thank you.
right.
Okay. It always happens like this, Doctor. We get somebody like you on with all this wonderful information and the time just flies by. But before we thank you for appearing on our program, we would like to say that the Good Health Women's Immunization Network is our commitment to building an army of good health champions who understand the importance of immunization across the lifespan. Through our network of trusted messengers and grassroots activities, our goal is to increase vaccination rates, help remove barriers, and increase access to vaccines and good health.
Yes. And Dr. Adelja, we would like to thank you for taking the time out of your busy schedule to inform our audience about COVID-19 updates. You've been
Right.
very informative.
Yes, you have.
And I'm hoping the listeners will take your advice.
Right. And we'd also like to
Yeah.
thank our listening audience for tuning in, and we invite you to join the National Council of Negro Women by calling 412-867-9641 for a membership brochure. We need your help to educate, advocate, and positively impact families and communities in the Rankin, Mon Valley, and Pittsburgh area. Remember, our live program airs on the first Friday of every month, unless there's a holiday on that month. So thank you once again. Thank you so much, Doctor. And Alice, have a great evening, everybody.
Yes.
Everybody remember, what
Yeah.
we're going to remember, get vaccinated.
Get vaccinated.
Right. Okay. Thank you.
Bye.
Bye.